The evolution of healthcare, eHealth has become the largest private marketplace for health insurance. It allows families and small businesses to compare health insurers and even purchase and enroll in coverage, both on the web and over the phone. Joining us right now in an exclusive interview is EHealth CEO Scott Flanders. Scott, it's great to see you. Thanks so much for joining us.
Thanks, Maria.
So let's talk about where the business is right now. As I was saying during the break, it's a great idea to be able to have all of the health insurance plans in front of you so you can compare and contrast. You've created competition.
Yeah, what we're trying to do is make it as easy to buy a health insurance plan as it is to order an airline ticket. And that's not been the way it is for seniors in particular.
So you started on Medicare. That's how you transitioned the business a bit. Tell us about that, because this is relatively new.
Yeah, the company started 22 years ago, and it was just helping individuals and families get in individual insurance plans. And then with Obamacare, the business got crushed, and it was really disrupted. So we pivoted to Medicare, and seniors need our help even more than people in other markets.
To select the Advantage plans, is that where you're most active, or even the drug plans to price out the drug options?
Well, you already know a lot more about Medicare than most people because it's confusing.
I have two parents who are, they're big consumers of Medicare, shall we say, but go ahead.
But do you help them select their plan?
We've talked about it, and run into, when I don't make the decisions, they run into hurdles. So.
Right. So, I think it's very important that all of us help our parents get into the right plan, and because the difference between being in the right plan and the wrong plan is thousands of dollars a year for seniors. And if they don't get the right drugs that they're on covered by the drug plan, then it's become unaffordable. And so what we do is just try to help decide for the senior, to give them advice, a recommendation. Should you be in a Medicare Advantage plan? Should you be in a Medicare Supplement plan? Do you need a Part D, which is the PDP drug plans? And so there's lots of acronyms. It's very confusing for seniors, and it's the highest consequential decision they make in their lives. And they need to make it every year because these plans change what they cover every single year.
How do you get compensated then, though?
We get paid by the health insurance carrier. So the consumer pays the same amount whether they buy through a broker, which is what we are, or buy directly through the health insurance carrier.
This stock has really reacted to the performance. You just posted earnings and beat expectations on revenue. What's driving the business right now?
Look, I mean, it always comes down to, are you helping consumers? And we grew our Medicare enrollment 64% in the fourth quarter, which is very satisfying because it means we helped hundreds and hundreds of thousands of seniors get into the right Medicare plan. I mean, that's the simple thing we do.
Love it.
Scott, I want to go back to something you said earlier, which is these are annual decisions, and I think the average senior probably doesn't realize they made a decision 4 years ago. They're not stuck with that. So maybe you can educate the audience about how often the renewals come up and what you need to do if you're in a renewal period if you want to switch.
Right. Every senior should review their plan every single year, because two things happen. One, their medications change every year. They may be seeing a new specialist that's not covered by the previous plan. That's one. Number two, the plans change. They widen and narrow their network of what doctors and what medications are covered every single year. I didn't understand this until we really dug into it, just how important it is to do an annual rate check and plan check for Medicare beneficiaries.
You all did a survey of Medicare beneficiaries over the January, February of this year. Only 6% of respondents said that they were dissatisfied with their Medicare coverage, but it seemed like in the survey there were also some points of concern about the future of Medicare. Tell me a little bit about that.
No, beautiful question, because the soundbite of Medicare for All is getting a lot of attention on the crawls on certain channels, and it's a complete fantasy. The biggest concern that seniors have, 81%, do not believe that Medicare will be around in 2 generations. The difference between Medicare and Medicaid is seniors pay into Medicare all their lives. That is an entitlement that's been earned from paying in. Medicaid is something that's given to people often who don't work. And so the emotion in the senior community around Medicare is very defensive.
Do they understand that the Medicare for All plan, pushed by Bernie Sanders, that was introduced and co-sponsored and endorsed by the likes of Cory Booker, Kirsten Gillibrand, Kamala Harris, Elizabeth Warren, it does away with Medicare. It actually abolishes and outlaws private insurance in this country. Do they understand that?
No, but you're absolutely right. This is what we would go to. We would go from a system of choice where you can buy in to a multiple of different selections to one mandated, dictated plan. And so if you think healthcare costs a lot now, wait till it's a monopoly. Okay, so this is seniors get it, though. The reason that this was an important question in the survey is for 81% of seniors in a broad-based survey to align on one point of view, which is that Medicare is not stable. They're afraid of it. They don't want it tampered with. Medicare for All will obliterate Medicare for the people that deserve it.
Are you doing anything in terms of your business with these plans out there looming? I mean, are you going to have to make changes in your business should something like this materialize?
Well, look, I mean, the reality of this, to get down to the eHealth, Medicare for More, which is the way this would go. First, it would go from 65 to 62, and then from 62 age to 55. That would be good for us.
Yeah. Scott, it's great to have you on the program. Thanks so much.
Thank you.
Scott Flanders joining us.